Hi, and welcome to A View from the Bed. This is a CHI St. Vincent podcast where we talk to real patients about their healthcare perspective. We know that your healthcare journey can be scary, so that's why we want to get their view on the good, the bad, and the ugly from diagnosis to recovery. Enjoy today's episode. Welcome to today's podcast. We are speaking with Charles, who is a patient of one of our pulmonologists. And so, Charles, thank you for being with us today.
Thank you for having me.
Yeah. So we did talk to Dr. Fanous, who's your pulmonologist, and got a little bit of a background.
Okay.
But I want to start from the beginning. When did you even know you needed to see a pulmonologist?
So back last August, I had an episode where I nearly passed out in my yard.
Oh, my gosh.
With family. We were doing some yard cleanup in the middle of summer.
Okay.
And on that Saturday, I had to lay down. My aunt decided that I probably needed to go to the hospital. I said, no, I'll be fine. It'll be over with. Before I came into work Monday, and sometime during the day Monday, I had walked halfway across the hospital and back and was out of breath.
Okay.
And so, thankfully, I've got coworkers that care enough to say, no, we're taking you to the ER. And I was taken to the ER then, examined.
Okay.
And then referred to my primary care physician, who did an immediate referral to pulmonology. So that's when we got started.
That's how it all started.
Mm-hmm.
So when you were about to pass out, when you were doing the yard work, and of course, you know, here in Arkansas at that time of year, it's beyond hot.
It is.
So it is easy to kind of brush it off and just say, I got overheated. I need to just rest. But at that time, did you have any shortness of breath before you felt like you were going to pass out?
It was more vision issues, you know. I felt like I was overheated, and I did feel like that I was losing, I guess, full consciousness. I still knew what was going on, but that white sheet that you normally see whenever you feel like you're about to faint or something, that's where I had gotten to.
Okay.
And then I just didn't feel right, so I had to lay down and know before I passed out or got dizzy.
Okay. When you laid down, did you feel better?
I did after a little bit. Yeah, I laid down and I got some water in and I felt better.
Okay. And then had you ever been out of breath before, like when you were walking across, like at work, a long distance? Had you ever gotten that shortness of breath before, or was that new for you?
Well, this is something that's been going on for quite a while.
Okay.
Usually it's a day here or a day there, and I might have to catch my breath for a couple of minutes, and then I'm gone again. I never thought anything of it until this event.
What did they tell you in the ER? Did they run any tests at that point, or? They
ran a barrage of tests. I had x-rays and a couple other things, AKG. They said, finally, we see something on your lungs. We don't know. It might be cancer. It might not. Okay. And so we had a cancer scare.
Okay. Yeah, that's scary.
And they said, we don't know what's going on, so we need you to go follow up as soon as possible with your primary care. So the next day I was in the primary care office.
Okay. And then your primary care doctor immediately referred you?
Yes, he started pulling the notes from the ER.
Okay.
And from there, he started looking at what the ER was looking at and saying, no, I don't think we can call this cancer yet. Let's go get you over to a pulmonologist as soon as we can and see if they can figure out what's going on.
Okay. So how quickly from the time you saw your primary care doctor were you able to get into Dr. Fanous?
2 to 3 days.
Oh, that's wonderful.
Due to the urgency of the issue.
Yeah. So how did that experience go? Walk us through what that appointment looked like with Dr. Fanous.
So I walked in, and the first thing he wanted to do, he wanted to see what the ER had said. He wanted to see what my primary care wanted. And then he started ordering tests. I had a bronchoscopy exam with ultrasound done like a week or two later even, just to see what was going on. Yeah. So from there, he tried to actually escalate everything as fast as he could.
Yeah. So when did you finally get a diagnosis in place, and what was that diagnosis?
I think about a month in, the first part of September, I believe it was, after the bronchoscopy, after some CTs, some x-rays and different things, he was finally able to confidently come back and say, we found you had pneumonia.
Oh.
And sarcoidosis on top of it. We don't know how long you've had the sarcoidosis.
Okay. So with sarcoidosis, for folks that don't know exactly what that is it is an inflammatory issue. It can be autoimmune, and it forms nodules, non-cancerous nodules in different parts of the body.
Mm-hmm.
And so in Charles's case, it was his lungs.
Yes,
but it can occur in other parts of the body, not just your lungs. So there had to be a little bit of relief that it wasn't cancer, but then also, what else did you feel? Because, sarcoidosis isn't something you hear a ton of people talk about.
Right. Well, it was a relief, and like you said, that it wasn't cancer, but I also reached out to other people, friends and family that said, yeah, my dad's got this, or my brother or somebody, who has gotten this, and they're fine with it. They may go in for treatment, every so often, but it's nice to know that it's not something that's necessarily going to kill us right away. Yeah. It's something that we can get over.
Yeah, that you can manage well.
You can manage with treatment.
Yeah.
Sometimes you can manage without treatment.
Okay. So is it something that you learned? Does it run in your family?
I'm the first person that I know of that's had it.
Okay. So that's good to know, is that it doesn't have to be a familial genetic cause. So again, that's why it was really important that your coworkers were like, no, you need to go to the ER. Because you didn't have any thought process beforehand that this could be an issue. So how do you treat it?
So normally what happens is it's treated with steroids that can be given orally.
Okay.
If you're in a hospital setting, if it's more emergent, you may have to be given your steroids through an IV.
Okay.
But for regular maintenance, they can do oral steroids.
Okay. Now, is it something, do you take the steroids every day, or is it just, do you take it when you have a flare-up?
So I'm not sure exactly what the dosing calls for.
Okay.
To this point, we have not put me on steroids.
Oh, well, that's good.
We're able to manage. I just saw him as late as yesterday, as a matter of fact. He said my sarcoidosis has stabilized.
Oh,
he believes. He's waiting on the official report from the radiologist.
Okay.
But he doesn't think that at this moment we need to start with steroids. So, but when we get to that point, if that happens, then I can definitely take the steroids. And, and it may be a daily thing. It may be a weekly thing. I don't know for sure yet.
Okay.
So currently the treatment plan that he's got me on is I want to see him every 6 months.
Okay.
We're going to have a CT scan, usually about once every time I go in.
Okay.
And a pulmonary function test about once a year. It may be every 6 months, but he lets me know at the appointment what I'm going to be doing the next time I see him.
Okay.
So for right now, he's going to monitor my situation. I've got other issues going on outside of this that are having to be monitored. And if something comes up from any other treatments that I may have by other physicians, then he might see me sooner.
Okay.
But that's where my communication with him comes in, to let him know, hey, here's a new diagnosis, or here's a new concern that's come up. What do you want to do?
Yeah. And I think too, when you have other conditions and might have other specialists, that is the great thing, is that a lot of times your specialists, they'll read the notes from the other specialists and talk to each other to make sure that the treatment they're doing for this other condition still coincides with the sarcoidosis, or, whatever else you have going on. So that's wonderful when you have physicians that communicate like that together.
Oh, yeah. And it also helps, that I come back at the visits and I can reinforce that information that they're receiving from the other specialists.
Yeah. No, having that continued touch point.
Mm-hmm.
And then obviously, I'm sure, if anything new pops up in between your 6-month visits, you could just call and get in to see him earlier.
Oh, and he encourages that, actually.
Good. That's awesome.
Mm-hmm.
Well, wonderful. So did he do any initial treatment once you got that, or was it let's watch and see how you do?
He has been somewhat reserved on treatment until he lets it run out for a while.
Okay.
Just to see, because he doesn't want to treat something that he doesn't have to treat. That's an unnecessary cost, and it's an inconvenience on the patient.
Sure.
So,
well, and that's a nice fact to know, is that when you go to a doctor,
yes,
they really want to pay attention to what you need, not just jump to a treatment right away if you don't need it. So how are you feeling? Do you notice things? You had mentioned earlier that, some days it'll come and go.
Mm-hmm.
Or is there anything that you do without medication to help you not have flare-ups of the symptoms?
So what I do is I have to stay away from irritants, lung irritants, like pollen, smoke, smog.
Right now.
It is. But I have to stay away from those things that would normally irritate your respiratory system.
Gotcha.
And if you have to be in those environments, wear a mask, wear a respirator, wear something to prevent those irritants from getting inside.
Okay. Like one of those yard working masks that you can buy at Home Depot or Lowe's or one of the big box home improvement stores.
Yep.
And just kind of pay attention to your environment.
Exactly.
I'm assuming too, sarcoidosis definitely would irritate, if you're around someone who smokes or vapes, or if you're a smoker. So that's something to be aware of as well. If you're around folks that smoke, or if you smoke, like I said. So that would be a really large event. But yeah, here in Arkansas, especially this time of year, it is so hard to avoid pollen.
It is bad.
And so do you just run from your car to inside really quick?
I just try to watch the weather and try not to get out in it no more than I have to. And if I have to be out, I try to go straight to where I need to go.
Yeah. So are you still going to be able to do yard work in the future with a mask on, or are you going to hire somebody? What are you doing about that?
So actually what I can do is limit my time outdoors.
Okay.
Wear a mask.
Okay.
And be hyper aware of any symptoms that may come up.
Yeah.
And then take immediate action as soon as I find out that something does come up.
Okay. I think that's a good plan. It's just, again, being aware of how you feel, how your breathing is. Do you notice you're breathing more now than you did before?
Yeah,
Do you pay attention more?
A little bit, yeah.
Yeah.
I'm actually doing better with it now.
Okay.
It's made it a lot easier, especially since the bronchoscopy. I've actually been able to breathe better since the pneumonia's finally gone.
That's good.
But I've also become more sensitive to other smells and things. Okay. So I'm more sensitive to irritants. So I do have to watch those as well.
Okay. How does your family and that support system, as you went through this process, what has that meant for you?
So every now and then I may have to remind my family members that, hey, I can't just get up and jump up and go. I need to rest a minute. I've just got through walking this far, or I just got through with this bit of yard work. I need to rest for a little bit.
Yeah.
But then I can go again, and they understand, oh, yeah, I forgot. You can't just get up and move like the rest of us. You may have to take a breath or two.
Yeah. No, I think that's good to know about, is tell people that you're around a lot so they're aware and can just be mindful of that. And again, it's not completely changing everything, but just having people be aware that, hey, it might take us a little bit longer to do this activity or, do something like that.
Right.
Well, that's awesome. Well, I think you're a classic example. And one of the reasons why we do this podcast is to remind patients that the number one thing that you should do, no matter if you're having a lung issue like Charles did and is working through, but always pay attention if you have symptoms that are not what you normally experience. If it's feelings of fainting, if it's feelings of being out of breath. Some of the symptoms too, when you look up sarcoidosis, is, You can even have chest pain and other related type symptoms depending on where the nodules are in your body. And so, and then having that relationship with your primary care provider and bringing up, hey, this feels a little different, or when I do this activity, it has changed a little bit for me. You know, I'm moving a little slower, or, you know, it's hard to catch my breath, because your symptoms really could be symptoms for a lot of things. Like they told you in the ER. They were like, it could be cancer, it could be this. And so it's like, we need to get you to a specialist to really help you hone down on what those are. So I think you're a classic example, Charles, and so amazing for sharing your story to remind people you need to just pay attention and then talk to your doctor. When it's not right, when it doesn't feel right, it probably isn't right. And listen to yourself and talk to your doctor. Or in Charles's case, if you do feel like you're not at a situation where you can drive or you have family members, call a family member if you live by yourself. You know, holler through the house, you know, if you feel like you're going to have a fainting spell or you're really out of breath. So don't stay isolated, you know, get people around you. Well, is there anything else about your experience that you would like to share with us?
I will say a lot of the things that I have done per the doctor's orders, especially with Dr. Fanous, has been somewhat scary to me, just for starters, because a lot of the tests that they do to narrow it down and find the sarcoidosis are things that I haven't been through before. So things like CTs and MRIs that you have to do, and bronchoscopies.
Yeah.
But trust your doctor. They know what's best for you.
Yeah.
And if you've got concerns, let them know, hey, I'm concerned about this, or I'm anxious about this. Let them talk you through it.
Yeah.
And by the end of it, you're like, that was a breeze. I could do this again.
Yeah. Kind of takes that fear out of it. Especially when your doctor can't read your mind. And so if you have questions about how the procedure works or concerns, ask them. They're always willing to stop and say, yeah, here's what that looks like. Here's what that will feel like. Here's what you can expect. And it's okay to be open.
Yeah, and it helps me out with Dr. Fanous, especially because not only do we get to see each other during the visits, we may see each other out and about outside of his clinic.
Oh, yeah.
And anytime we see each other, he stops. He makes a point. Hey, Charles, how are you doing today? How do you feel today?
Yeah.
And he is willing to listen, and he's willing to take my concerns and work with those. So it really helps to find that one doctor that will actually take charge of your situation and actually be somewhat concerned. Or in my case, I feel he's really concerned because he follows me through wherever I'm going.
Yeah.
So
that is really important, is that trust.
To have that trust and that cooperation with your doctor to know that you've got somebody to talk to. Yeah.
Especially when it's a new thing. It's not like you have a family member you can call, you know, that has been through it or you've seen it. And especially, when it's a very new.
And every case is different.
Yeah. I think that's such a good point, Charles, that find a doctor you trust and, again, really will take that time with you to make sure you're okay. Well, I'm glad you're okay.
Me too.
I would never know that you had a condition like sarcoidosis.
And most people don't know from the outside looking in.
Yeah.
Because it doesn't affect necessarily everybody the same way.
Exactly. Yeah. Well, I am so glad that you're feeling good. You have a good treatment plan. You're watching it. Hopefully it has kind of settled down and it's static for a little bit for you. And we really do appreciate you sharing your story with us. So
thank you for asking.
Well, Charles, thank you for joining us today on the podcast. And thank you so much for sharing your story. And
absolutely.
And, you know, the whole goal is hopefully something that you've been through will help somebody watching, and is always a reminder to touch point with your doctor, whether it's your specialist or your primary care doctor. And like we said earlier, you know, if it doesn't feel right, it probably isn't right. So bring it up. Don't wait for your next visit. Call them, call the nurse. And so thank you very much. And Until next time, who knows who we'll be talking to? And, we always bring you something, though, that will benefit your health and keep you more educated on things to watch for. And again, always pay attention to those symptoms. Thank you. Thanks for joining us for today's episode of A View from the Bed, A Patient's Perspective. We hope that you found it helpful. We hope that it helped you make your healthcare decisions. We hope that it made you feel a little more comfortable with your own journey. And we hope that you'll join us next time.